That was the white matter that primarily has different pathways or tracks that carry information from our body into our brain and from our brain down and out to our body. Now, we're going to talk about what's called the gray matter now, or the dorsal and ventral horn of the gray matter. There are different things that go on in this area, different tracks. Remember that the fibers I talked about, and they go in parallel, although there's some that interconnect, which we'll get to here in a second. They're not so parallel, but let's go there. This, actually, you know what? Let me start with some different colors here. In this area of the core, the gray matter, it's called, and all of these areas in the gray matter are called lamina. This is probably more information than I need to give, but sorry. They're called lamina. This is lamina 1. And lamina 1 transmits some aspects of pain. Now I said, well, this anterolateral system transmits pain too. Yeah, because this information eventually goes over to this track and goes up to the brain. But this area here, lamina 1, transmits some aspects of pain. And here's the thing. We talked about how different levels of the spine supply and send different nerve signals out of that area and receive different nerve signals. Well, when we're talking about pain, a pain signal can come in from the body into a certain level of the spine. Let's say it's lumbar level 4. There is an area here called the tract of Lissauer that transmits those pain signals a couple levels above and a couple levels below, so it mixes with other nerve signals at those levels that may create some pain in areas of our body that really is not even having any type of pain signal being irritated or stimulated. Now that's where the functional aspect of the nervous system can be very overlapping. It's not all hardwired like used to be thought of, even 20, 30 years ago. As functional anatomy or neuroanatomy and neurophysiology is expanding daily, we are learning how many different aspects of our nervous system actually overlap, so we can stimulate one area which has an effect on another area, good or bad. So that's lamina 1. We're going to go to another color here. Let's go here to lamina 2. Okay? I don't know if you can see that very well, but okay? Lamina 2. It's called the substantia gelatinosa. Now, lamina 2 primarily has to do with modulating or kind of controlling aspects of pain and temperature. Now, at lamina 2 that area has a lot to do with what is called the pain gate control theory, and this is what that is. Let me give you an example. You ever hit your head on something? Of course you have. And you rub it like this. Or your mom and dad say, well, rub it, rub it, rub it. And what are you rubbing it for? It seems to make it feel better. Well, this aspect here at lamina 2, that has to do with that phenomena. That when we have a pain nerve that's irritated and it gets sent into this lamina 2, the nerve signals get sent in there, we can use other nerves like the touch nerves. And we talked about different receptors. We have pain nerves, we have hot and cold nerves, we have joint position nerves, we have movement nerves, we have touch nerves that receive that information. When you rub your head, you hit your head and you're rubbing it, it seems to make it feel better. It's a real thing because the pain nerves have been stimulated by smacking your head. You're rubbing your head, you're stimulating surface skin nerves and other nerves that don't have to directly do with stimulating pain, But those nerves are stimulated, sending a nerve signal that ultimately goes into lamina 2 to help block some of the sensation of pain. That's why you may have some aspects of chronic pain at times, when you're not very active. So you have, for some reason, you have certain aspects of the things that control your perception of pain are being stimulated in a certain way. Or not stimulated, but we will get into that later. Another show. But when you get active and you say, I hear this all the time from patients, when I get moving around, I really don't feel it. They say, I must take my mind off it, which that may be part of it. But another major part of not feeling that pain when you are more active in moving around is because you are stimulating joint position sense nerves, you are stimulating movement nerves, you are stimulating nerves that are in muscles and tendons and ligaments that send their nerve signals that aren't transmitting pain at that time because they're not injured into lamina 2. Which helps block some of the transmission of that pain. The gate control theory, and it's not really a theory anymore, it's pretty well understood. That's why when you hear me talking about staying more flexible, staying more muscularly balanced, keeping your joints more flexible, not allowing you to get stiff and tight over time. You may have a disc herniation or some kind of structural damage, but along with that, you have some stiffness and tightness of muscles and joints that are not allowing you to more naturally dampen pain that is maybe emanating from, say, a disc problem. That's why most spinal disc problems don't need surgery. Because if you are able to get the right care to improve the function of the nerve signals coming from that body anatomy into our spinal cord, quite frankly, you can naturally dampen the amount of pain that you feel that may be coming from that disc problem. Okay? So this lamina 2, very important part of things for a number of different reasons. Now, there's 10 lamina, there's 10 sections to this gray matter in the spinal cord. And these next 3 through 6, here, and I'll just kind of color this in here. Okay? This area through here really has a lot to do with what we call sensory processing. So sensory means what? A nerve receives something, or a receptor receives something, it senses something, whether it's wind or touch or hot or cold or whatever, pain, and it sends those signals, electrical signals, up into our spinal cord. This is the major area where those signals coming from sensing something they go into and are transmitted to different tracts and are sent up to our brain. Now, this is where my artwork has fallen apart. I didn't make this area big enough, but anyhow, you'll get the gist of it. There's another section here called lamina 7. And that area of the gray matter has a lot to do with our autonomic nervous system. Parasympathetic and sympathetic nervous systems that have a lot to do with organ function and directly have to do with immune system strength. And a lot of that aspect of the nervous system, which is totally another couple of shows to go over that system, which we'll get to. Now there's 3 more areas here, okay? These 2 green areas here are lamina 9, but in through here is some of lamina 8. Lamina 8 are some connectors. They're called interneurons. A lot of them are interneurons, and they connect different other lamina and different other aspects of the nervous system to tell different areas, what's going on over here, what's going on over there. Lamina 8 is primarily those motor nerve fibers. That motor is nerve signals coming from our brain through our spinal cord and out to different body areas. Then we have an area here in the middle. That's called lamina 10. Well, that's not a good one there. Does it really matter, folks? Yeah, I think it does. Right through here, called lamina 10, and we won't get into that one. So there's 10 lamina. There's many different tracts in the white matter. There's many different lamina, or you can even call them tracts, so to speak, in the gray matter of the spinal cord. Each one of them transmits different things. Now there's a couple areas here. I want to do this really quickly. There's an area here, okay? And there's an area here that are sensory tracts as well in the white matter. Very, very major important tracts called the fasciculus gracilis and fasciculus cuneatus. The one in the middle transmits joint position sense and vibration, knowing that if I close my eyes, I just move my knee that way, and vibration from our lower extremity, and the cuneatus is from our upper extremity. Very, very important. All of this is important, but these are very, very important tracts because we want to keep those tracts, as well as all of them, but those tracts more active. And the way we keep them more active is, once again, to be more muscularly balanced, to be more muscularly and ligamentously, is that a word? I just made it one if it's not. And other soft tissues, make them more flexible appropriately, because then they send more appropriate nerve signals into these tracts that eventually lead up to the brain. We talked about the spinal cord today, and the spinal cord generally is a superhighway which carries messages, nerve signals, from our body to our brain and from our brain to our body. That's what it does. There are different sections of the spinal cord that do different things. We want to keep areas of that spinal cord more healthy by keeping it more stimulated appropriately. There's a lot of different ways to do that, but one of the ways for many of the different tracts, and we talked about how it can impact pain, a natural pain reliever, is to be more appropriately flexible in our muscles and joints and ligaments of our body, and more muscularly balanced, and certainly being more active. That's really the biggest reason why we all know we're supposed to exercise. Thanks for joining me this week, folks, here on Naturally Healthy. We'll see you back, and have a great day.